To perform tracheostomy care, you will need a bottle of normal saline, a bottle of 3% hydrogen peroxide, and a tracheostomy care kit. Remove the caps from the saline bottle and the hydrogen peroxide bottle first. Put the caps down with the caps facing up. Next, carefully open the trach tray. Pull out the sterile drape and lay it down on the table. Place one sterile glove on your dominant hand. You may arrange all of the contents of the tracheostomy tray on your sterile field. Next, remove the basin. Pour some normal saline in both wells. Pour peroxide into the larger well so that you end up with a 50-50 solution. After filling the basin, put on the second sterile glove. You may arrange all of the contents of the tracheostomy tray on your sterile field. Next, pull the swabs from the sterile field and dip one in the 50-50 mixture and the other one in normal saline, and place them each in the third basin that's provided. There are 3 or 4 sterile gauze on your sterile field. Use one of them to remove the tracheostomy cannula. Be sure to secure the tracheostomy with your other hand as you remove the cannula. Place the cannula in the 50-50 solution. Scrub the inner part of the cannula with the brush and scrub the outer part of the cannula as well. Be sure to remove all secretions. Next, drop the cannula into the basin with normal saline to rinse. Pick the cannula up and tap it on the center. Next, dry the inside of the cannula using the sterile pipe cleaners, and use another piece of sterile gauze to dry the cannula on the outside. Using one hand to support the tracheostomy, replace the cannula using a slight twisting motion. Carefully remove the old trach drain sponge, making sure to keep the other hand securing the tracheostomy. Look at the sponge to see what kind of secretions are there, if any. Make a note of the color and the consistency. Clean around the stoma, first using the swab from the 50-50 solution, and next using the swab from the normal saline solution. We do not want to leave any hydrogen peroxide on the skin. You also want to assess the stoma site and make sure that there is no drainage or swelling or redness. Carefully replace a sterile drain sponge. Make sure you keep the tracheostomy very secure as you are carefully placing the new dressing. When replacing trach ties, always put the new trach ties on before removing the old ones. In this example, we see Velcro ties. Do not place the ties too tightly. You should be able to put 2 fingers underneath the ties comfortably. Always put the new trach ties on before removing the old ones. Here is an example of replacing the ties with the twill tape that comes in the package. When replacing trach ties, always put the new trach ties on before removing the old ones. Do not place the ties too tightly. You should be able to put 2 fingers underneath the ties comfortably.
This is the University of Hawaii Maui College, the college on Maui.